Okay, I think we can start. So thanks to everyone for joining this event. This is the third webinar we are presenting in the framework of iCare Smart project. And during these events, we are sharing some best practices, some successful example of supporting innovation system and in the field of healthcare, especially for older adults. And today, Ingrid Adriaensen will present how the LiCalab, the Living Lab, is doing so. So how they are facing with the trouble to build up a community around the innovation of in healthcare, to support the newborn ideas and to identify how to put on the same factor the experience of the end users, of the formal and informal caregivers, and what researchers and businesses can provide in terms of new services and devices. So I leave immediately the floor to Ingrid. And thanks again to give us this opportunity to know something more about Living Lab and especially about LiCalab. Please.
Okay, well, thank you very much. Good afternoon, everybody, and thank you for giving me the opportunity to present LiCalab here. Today, I would like to speak indeed about how Living Labs can support system innovation in healthcare and how we can build a community and how we can support both businesses as organizations, as local authorities in innovation processes. In general, I start with a few slides on what Living Labs actually are, because in fact, it seems that the term Living Lab is not always clear for everybody. And we always start from the definition from ENO, which is the European Network of Living Labs, that says that Living Labs are open innovation ecosystems based on a systematic user co-creation approach that integrates research and innovation activities. And most important, that this happens in communities where the citizens are placed at the center of the innovation. It is also important to know that people can be involved in all phases of the innovation process, thanks to Living Lab methods. This can be from really idea generation, need finding, to building prototypes, from design to commercialization. Now, Living Labs have a lot in common, means that the basis is that it is multi-stakeholder and end-user driven, that we work with co-creation methods in innovation design and design thinking. We develop with, for, and by end users. We execute real-life experiments to shorten the time from research and product design to the market. We collaborate with our local innovation ecosystems because the local Living Labs know their local ecosystem the best. And we play a role of orchestrator, of matchmaker, of facilitator to really bridge the innovation skills and the investment gap. And of course, last but not least, it's important that Living Labs have the expertise, the capacity, and the knowledge of methodologies to orchestrate this co-innovation and experimentation processes to assess solutions impact and create future business and value models. Now, in fact, there are also differences between Living Labs because Living Labs are sometimes hosted in different organizations, can be academic institutions, can be research and innovation agencies, it can be public entities, for instance, cities or regions, can also be private companies. Also, the thematic areas can be different, but we see that a lot of Living Labs situate themselves in health and well-being. When we speak about Living Lab environments in healthcare, it's not always an infrastructure, a real research infrastructure, but of course this can be part of it. But also the real life environments like hospitals, residential care settings, homes of citizens, health centers can be Living Lab environments. And then there can also be differences in services going from needs analysis until really dissemination, market uptake, and so on. What are the most expected services from companies and organizations to participate in Living Lab projects? In fact, we worked in an international project, which was cross-care. It was cross-border, Netherlands and Flanders. And we, after the services were delivered, we checked with the companies why they wanted to use the Living Lab services. And the top 5 they mentioned was, in the first place, selection and recruitment of end users. And I will come back to that later on. The development and the testing of the innovation with end users, also being informed about regulations and reimbursement, the access to infrastructure for Living Lab activities, and the business expertise and coaching in a health market. So the primary need is really to gain user insight and state-of-the-art knowledge in a cross-border market. What was also remarkable was that 50% of the participating companies said that they would not have included Living Lab support in their innovation process without the financial support of the project. So that is important to know, but these type of projects, they help to bring out the idea of Living Lab support. Maybe also a few words about LiCalab. LiCalab was founded in 2012 as a spin-off of an innovation project of a local authority, which is the city of Turnhout. It's a city of a bit more than 40,000 inhabitants. And it was funded by the Flemish government between 2013 and 2016 in a program in which 6 Flemish Living Labs were built. 3 of them are still active now. Then we worked as a non-profit organization until 2019. And since 2019, we are part of the research unit of the Thomas More University of Applied Sciences, which is situated in the province of Antwerp in Belgium. LiCalab is also founding member of a local health and care network, the Health and Care Network Kempen. And when we speak of Kempen, that's a part of the province of Antwerp that has a bit more than 500,000 inhabitants. LiCalab is also coordinator of an EIP on AHA, reference site for active and healthy aging. And we are an accredited member of the European Network of Living Labs and of EIT Health. Our focus areas are care technology, which can be e-health, medtech, assistive technology, communication tools, but also collaboration models in care settings. What do we mean by that? It's collaboration models between, for instance, companies and care organizations, but also between the different levels of care organizations, for instance, first-line care and second-line care, or collaborations with local authorities and care organizations, local authorities and businesses, and so on. So we try to support these processes to set up projects in that context. We as LiCalab do not have an own research infrastructure as ourselves. So we say that we offer Living Lab activities as a service from exploration over co-creation to testing and business model advice. Some other Living Labs do have research infrastructure, but for us, these Living Lab test environments situate themselves in the homes of elderly or citizens, patients, and we have our own user panel of over 1,200 people, which are composed of indeed seniors, healthy citizens, patients, but also informal caregivers that can participate in projects that we launch. Second pillar, of course, is the professional side, where we work together with nursing homes, hospitals, home care professionals, health practitioners, and there we also have a network or access to a network of 20,000 care professionals. And then last but not least, we are part of the European Network of Living Labs and the EIT Health, which helps us to elaborate the international network. When we look at recent numbers for LiCalab, despite the Corona year 2021, we managed to do 23 business projects, and we participate in 8 European projects. We reached over 1,500 citizens in 2021, 279 healthcare actors, and also 124 staff members from governmental organizations. The activities that we did most were online co-creation sessions, mostly online, surveys and expert interviews, but also real-life testings, market studies, and also quite some workshops and trainings. We also work on publications about the Living Lab work that we do. Now that's a little bit of an intro. Now the main goal of today is to talk a little bit about how we can support the systemic ecosystem innovation. And I would like to present a few cases in which we have been doing this or are currently doing this. But first, I would like to point out a few important pillars of maintaining a sustainable living lab. And it all starts with the network. Then I will talk a little bit about the user panel, how we built it, the Living Lab activities and methodologies, and then go into depth into a few cases. So what I said already is that Living Lab really operates as a facilitator in the ecosystem and in the whole innovation chain. It starts with the panel and community management, but also research methods and research methodologies are very important when it comes to innovation. We reach out to public authorities, not only for collaboration, but also when we have done some need finding within the care sector, we can feed this back to the public authorities for information. And then, of course, we collaborate a lot with businesses and in our international network. We think that both the local network and the international network are key, and that we really have to take care of these relationships and maintain them, and just be really acting as a facilitator in this ecosystem. Now for the user panel. In fact, I said that we started in 2012 with our Living Lab. And you see in the beginning, we had almost 400 participants in our panel database where we could reach out to participate in projects. Now these are the numbers of 2020, and we are over 1,200, which has asked for us a lot of effort, of course, but we think it's important. When we look at the composition of this panel database, we see that 33% are care professionals, 67% are citizens, which can be patient, informal caregivers, seniors, or healthy persons. And when you look at the age categories, we started off as a Living Lab specifically for seniors. And you see that still 70% of our participants are over 60 years old, of which 15% is over 80 years. But through the projects that we've been doing over the years, we also expanded our database to age categories that are lower, between 40 and 60, but also under 40 years old. Sorry. So why is the user panel important? It's important because we think, I'm sorry, because we think that it's really the engine of the Living Lab. And it makes that we can do a faster recruitment for concrete assignments. Because we have this firm panel database with a lot of information in it, so we can reach out easily to the right profiles. We also think that our panelists are the ambassadors of our Living Lab, but it's important to keep the user panel engaged. I'm sorry, I really have to stop for a moment. Sorry for that.
Yes, please. I would like to remember that if you have some questions, you can write them on a chat, And at the end of the presentation, we reserve some spaces for question and answers time. We are also trying to collect these questions via Facebook channels. And we can copy them or present them to Ingrid directly during the meeting after the end of the presentation. So we can have a small break of 2 minutes in order to check if everything is going on also on live streaming, and then we can continue. Ingrid, as soon as you can. The floor is yours.
Yes, I'm sorry, but I have a cold and I was afraid that I was losing my voice indeed. So I'll try to continue without too many problems. So yeah, what I was saying was that the user panel is really important for us because the panelists are really the ambassadors of our Living Lab. And you really have to value, yeah, sorry, it doesn't work. So I'm back. Try to. So it's important to keep the user panel engaged with information, feedback on projects, a monthly newsletter, and a yearly event. And also to grow the panel, to go on the road with presentations, be present on social media, and so on. And here you see a few pictures of our Living Lab in action. Third pillar is, of course, that you do your Living Lab activities, that you work on concrete projects, and that you know your methodologies. Because, of course, you have the different phases in the innovation chain, from idea screening and evaluation until the market launch. But in fact, it's really not a linear process. It's really like a fuzzy process, where you start with a lot of information and where you end with a solution, but going through a lot of iterations. Each assignment that you do is custom made in consultation with the client, and methodologies can be common, like co-creation, focus groups, and so on, but the thematics are often really different. We also always use validated tools, like quality of life measurements, technology assessments, and so on. And we pay a lot of attention to legal procedures to see that we are working GDPR proof, that we work with consent letters, that for every action that we do where a medical ethical approval is needed, that we make sure that this is in order. Sometimes when we work with companies, we need to sign NDAs, or we also work with order confirmations and contractual service agreements. Then I would like to present a few cases. So we work directly with companies, and I just took out 2 examples, but we have many, many more, of course. So for those who are interested, you can take a look at our website. But the first one is a tool that you can put in shoes for freezing, to avoid freezing of gait and fall with Parkinson patients. And the role of LiCalab here was to do expert interviews with neurologists and physiotherapists. We did a quantitative survey of Parkinson patients and informal caregivers. We did a quantitative survey of management and head nurses of residential care centers. And we did co-creation sessions with Parkinson patients that suffered from freezing of gait. So that is one example. Another example is a pill box for medicine, a medicine dispensing package, which can be filled with individual medicines for each intake moment, and which is using an electronic tag that reminds the patient when it's time to take his medication. So here we had a role that we took on to interview pharmacists. We did a human factor study, which is an interactive study, an observational study, in fact, where we asked people to interact with the medicine package. And we also did a market study. So that are two examples from cases that we do directly with companies. But the thing is that when you can do larger projects where you bring different parties together, you can really do wonderful things. So one of the cases that we have been doing is an example of a collaboration between companies and care providers. So the project is called Welgerust, which in English means well rested. And it's a multi-actor project that started from the challenge of sleeping problems, which is really a very big problem these days. And the idea behind it was to build a blended care approach based on both the use of technological support tools and personal advice from psychologists. The target group were adults between 18 and 17 years old, first-line carers, GPs, pharmacists, and psychologists, and also the local hospital was involved. The technological device that has been used was from a Belgian startup company, which is called Moonbird. And Moonbird is a device that supports people with sleeping problems with breathing exercises on the basis of biofeedback. So when you put your thumb on the button, it indicates, it measures a breathing, your heartbeat, and it indicates an ideal breathing rhythm, which makes it easier to fall asleep. When we look at, yes?
Ingrid, sorry, I'm not sure, but we are looking at your presentation point number 2.
I'm sorry. Yes, sorry. Yeah.
That's
yes. Okay,
thanks.
No problem. Yes. So yes, I was talking about this multi-actor project, well rested, and the Moonbird device. What I was going to say is about the role of LiCalab. So what we did, the project started in February 2020, where we did a co-creation session with all these different actors about needs. Then we started the live test in August, November, with 3 testing rounds. We recruited through general practitioners and pharmacists, and we worked with 28 participants. And then we had a feedback session on the solution in December. And then also, because it's a multi-actor project, we had a workshop on business modeling with GPs, psychologists, pharmacists, a local hospital, and the company. And then half a year later, we did a second live test because in the first live test, what we remarked was that mainly women participated when we when we sent out our call. It were mainly women that responded to that. So we decided to do a second test with only male test persons. And here we also did 2 testing rounds, and 39 people participated. And in November, we also did a co-creation with children and their parents to adapt to children's use. And then within short, we will also offer a publication on this study. Now, what is the result of this project that started in 2020? It's the fact that we brought together all these different stakeholders has led to a regional action plan in the region of Kempen with all relevant stakeholders to work on sleeping disorders and sleeping problems. And this will lead to the foundation of a non-profit association in which all these relevant stakeholders are represented to work further on the challenge of sleeping problems, and with the main goals to have an early detection, so to avoid too much medication, to have an effective management of sleeping disorders, and also to obtain a better collaboration between caregivers on prevention actors, general practitioners, psychologists, and hospitals. So that is a nice example that shows that as a living lab, you are a facilitator to bring all these separate parties together and to lead to something that really can be sustainable in the long term, even after the living lab is not present anymore. The second case that I would like to talk about is more focused on a collaboration with local authorities. And it's called Bebop. And Bebop means Burgers in Beweging met een online preventieplatform, which is moving citizens through an online platform. So what is this? It's a data platform, an innovative data platform that works on personalized prevention. The goal of this project was also to investigate the supporting role of local governments. And also one of the main things is that the citizen has to be considered as owner of his own data. Partners in this project was the Flemish Institute for Technological Development, who developed the platform, Thomas More University College and LiCalab, and the city of Turnhout, plus 4 local communities and Domus Medica. So what are the components of Bebop? In fact, it starts from the health guide of Domus Medica. Domus Medica is the Association of General Practitioners that has been used on paper until now, this health guide by GPs, and that has been digitized for the project Bebop, and it asks questions about lifestyle specifically. Secondly, the goal is to link a local action plan with activities to the outcome of this health guide. And this local action plan is supported also by care providers. And linked to this Bebop, other applications can be developed, like applications for corona risk calculation. And all these data come together and are managed in the platform with the main goal that these data can also be used for further research, but always with the consent of the participant or the citizen. So in fact, it's an instrument that is based on scientific evidence, because GPs have been using it for many years already, to support the creation of a personalized prevention plan. So the health guide is a questionnaire, and it can be completed or by the general practitioner together with the citizen or the citizen alone. And it calculates a risk profile that is based on lifestyle data and that gives individualized health advice. Then it builds a database of activities, a local offer. It can be something for instance, people who offer food advice, but also activities for hiking or for running. So it can be very diverse. So the database of activities is linked to the platform, and the people who have filled in the form, they can get this personalized advice and an idea of how they can start moving or start doing something about their diet, for instance. So this means that they can take targeted actions to reduce the risk of chronic disease and stay longer healthy. What an extra is that there is an integration into the federal e-health system, which offers optimal security. It will also make the link with the personal patient files via e-form technology. It offers a direct interaction with other healthcare providers, and a citizen can decide if he wants to share this information with his general practitioner for follow-up and additional advice with personal consent. So what was the role of LiCalab here? We did co-creation sessions with care professionals, with end users, also vulnerable end users, with local authorities representatives, and with service providers. We did a pilot test in cooperation with health insurance organizations. We did a pilot test with GP practices in 4 municipalities and in 1 city. We also did a pilot test with an app for corona risk calculation. And we did a real-life test in 4 municipalities and 1 city after we sent out the communication campaign. And on the planning is really the rollout in the 5 local municipalities and first line care in other regions in Flanders. So yeah, other apps that are linked to the platform is what I said, is this corona risk classifier that calculates risk of people for catching corona based on underlying diseases, the place of residence, behavior, vaccination status, physical activity, and so on. And also a chatbot is included now in the app to support a healthy lifestyle for nutrition, exercise, anxiety, vaccination. So when we take a look at the involvement of different organizations and people, we see that we have been able to involve 6 local authorities, over 250 citizens in the pilot phases, 3 GPs, 3 healthcare insurance organizations. We did 10 co-creation sessions and 4 live pilot tests. So the involvement of the citizens here, the plus 250 was really in the pilot setting, but after the launch, there were 345 citizens that already started a conversation with the chatbot on COVID risk factors. And there are already 478 citizens that provided consent to use their data for research. And the project is further being rolled out by the different partners that are involved. So it's a lot about data management that is really a citizen-centric approach in order to add to research and development innovation, to personalized products and services, and to support the better personal health. So that was a second case, which was multi-actor. And then I have a third case where we collaborated with a care organization and also a city. And the main question here was, how can dementia care be further developed within a care group? It's called Orion and the city of Turnhout. And we did the whole trajectory there, starting from stakeholder analysis until the creation of a future-proof dementia care plan. So starting with the stakeholder analysis, we did that internally in the care organization itself, and also externally with external stakeholders, but also with, for instance, the community around the care center, with politicians, with experts in dementia, and so on. Then we conducted a few workshops to identify needs with care professionals, informal carers, and volunteers, also with staff members from local authorities, and we conducted expert interviews. And then we did a few inspiration sessions where we attracted quite a lot of people as well. First session was about care technology. The second one about innovative work organization, always in the context of dementia care, dementia-friendly community, and dementia-friendly architecture. That's the one that is still going to be given later this week. So final goal is to end with a future-proof dementia care program. And then we will do a pilot testing to build a new campus really for this care center for people with dementia. And the main thing here is also to implement the new innovation, a new innovation mindset to provide really the best possible care in dementia, and really based on the input that we received from all these different stakeholders. So I think I explained this more or less. So starting in January 21 with stakeholder mapping, doing some desk research, need finding workshops, co-creation workshops, and then the inspiration sessions to end with the final reports on insights, with insights and recommendations. So what were the results of this? The highest priority that had been identified was the fact that you really have to involve internal staff, family members, volunteers, and the neighborhood and community, and really strengthen the participatory model. There is, in fact, an extra need for home care support as well, as most people with dementia are still living at home. And this is also preferred because then they can stay in their own familiar environment. But then it's really important that the participation in society and the integration in the community is ensured. So, and also that there's being paid attention to breaking the taboo on dementia. But of course, living at home is not always possible. And in that case, it came out very clearly that small-scale living is important, and that it's important to ensure a seamless transition from home care to residential care, to have more focus on living and well-being rather than on care in its own. So not talking about a care plan, for instance, but talking about a lifestyle plan. And that it's always, even when residents, even when people are not living at home anymore, but in a residential setting, that they are being involved in daily tasks. Technology can be of support, but it has to be technology with a human face. But it can support in dementia care to provide more autonomy and to give security. And then an important point that was also mentioned was that there is more need for information, more need for communication, and for psychoeducation. So that were 3 cases where we have this multi-actor approach, where we bring together different partners, different stakeholders. And then, of course, we also have cross-border collaboration, where we have a transnational living lab concept. And I mentioned a few projects here in which LiCalab is participating. First one is Vitalize, where 17 living lab structures in 11 countries work on harmonizing living lab tools and procedures for research. Second one is Cease to Grow. It's an Interreg project where 4 living labs from Belgium, France, the Netherlands, and the UK collaborated. It ended now in 2021, but there were 34 companies that we supported here with living lab services, each time in at least 2 of the 4 countries. I mentioned already in the beginning CrossCare, where we collaborated with 3 living labs in Belgium and 3 living labs in the Netherlands, where we supported 43 companies and organizations. And then Axel is an Interreg Europe project, which is about policy making, and here the basis is also on accelerating SME innovation capacities with a living lab approach, and it's a project that is still running, and where we identify good practices in the different participating countries to try to implement them in another region. So generally, lessons learned, I already mentioned. We think that a local and an international network is key to build a sustainable living lab. It's important to co-create a strong strategic plan with your stakeholders, that you talk about governance, that you talk about financial and HR resources, that you really think about how you can easily access end users, that you have the right methodologies on board. And the best way to start is just to start with concrete projects, with concrete actions, and working bottom up and top down, and always starting from a shared need. And then what we also felt, I said that LiCalab was started in 2012 and was supported between 2013 and 2016 by the Flemish government. And we probably wouldn't have made it without these 3 years of financial support from Flanders to develop our living lab and develop our first activities, to gain experience, to build our team, and so on. So this financial or operational support from public authorities or strong networks like health clusters, for instance, is really an added value to set up collaborative projects that include living lab methodology. A short presentation of our team. So there is myself, I'm working as a business manager. Then we have an operations manager. We have one project manager. Then we have a general practitioner also in our team who is also working as a research manager. We have 2 panel managers who are exclusively dedicated to the interaction with the panel members. And then we have 2 scientific coordinators who ensure the scientific evidence of the projects that we are running. So I think I have come to the end of my presentation with a few quotes of companies where we really want to say it's never too late to involve end users. So you can always involve them, and we hear that from the companies or organizations that we have been working with, that it really helps them to get further, that it also helps them to convince investors, because they have more evidence that there is really a need of what they want to bring on the market. And in that way, the living lab approach is really an extremely valuable way of working for supporting innovation. So that was all for me. Sorry about my voice and the interruptions. But I think if somebody wants to have more information, if you have more questions, I think there is some space for it now.
Yes, thanks a lot for your presentation. It was very clear for the example you provided, with also the detail of the timeline, because one of the key issues is to have enough time to adequately involve caregivers and end users, because all the time we dedicate to involve them is time that we preserve later on to modify the idea or the results. So in your experience, if you can imagine, which is the balance, how long we have to focus our attention on the preliminary analysis, how much long this is time that we have to reserve to interacting with the end users, I mean, to investigate, to make interviews, to analyze results before to start the development process.
Yes, well, it's all very, very individual. So it's what I say. You can start in all different phases, and the best, of course, is that you start as early as possible involving end users, even when you just start from an idea. That you talk to end users to feel their needs and to see how is their actual situation and what would help them to bring them further, and that you do that in an iterative way. And sometimes it can go quickly, but mostly it doesn't go that quickly. So you need some time to scape what you want to do. But it's difficult to say, well, you need like 1 month, or you need 6 months, or you need 2 years. I think really from coming from zero until a finished project, you have to go back several times to your user. So it's not just about going back one time or asking one time, but really like asking about the needs, develop something, go back, also do a study with your prototype, where you do like a prototype testing, and afterwards, when it's really a minimum viable product, that you that you do a live testing for a longer period. So it's different phases that you have to go through to come really from that initial idea until a feasible and a viable market introduction and market launch. And then I haven't even spoken of CE approval and so on. So that's also part of the whole process. For many things, you need clinical validation also, and it has to be proven that it really works. So yes, it's difficult to say you need so much time or so much time, because that's depending on what you want to develop, of course.
Of course, just to imagine that we can consider that this time at the beginning can be greater, and in subsequent phases can be reduced because you are refining your idea. So we can imagine that we can have a kind of 20% of your time at the beginning, and then how long is the initial phase? Short, and should be the latest phases when you propose the idea for the refinement. So probably this is also depends, of course, of the type of product or prototyping you are thinking about, the readiness, of course, but we can consider a good compromise to preserve more time at the beginning and less later on.
Yeah, it's in phases, huh? I mean, like organizing a co-creation session with end users, it doesn't have to take so much time. So you can bring end users together and you can have a discussion, and from one good managed co-creation session, you can already gather a lot of feedback, and then you have to go to the development table at a certain point, and then for a while nothing is happening directly with the end users, but then you go back and you do, for instance, a short testing of 2 weeks or 1 week, or just an observational study where you ask to interact with the device for a shorter period of time. So it really goes in phases. Yeah.
We have a question on the chat, if you can explain what are your learnings, what engage people, senior especially, also share critical perceptions?
So you mean that they are critical enough to give their feedbacks? Is that the question?
We can ask to the person who posted this question, but I think that sometimes senior are critical, and you can continue, you can engage more than when there is a kind of a priori barrier.
Well, they share critical perceptions for sure. So they never just say what we want them to say. That is not our experience. So they can be very critical, and often they are, of course, also very critical about the usability and about the way if it's easy to understand. And also the price, because often that's the first question that especially seniors also ask, like, what is the price? Because that's important for them as well.
Yeah. And I have, if there are other questions, please write them on the chat. But I have a question because I noticed that specifically in one of your examples, you highlight how many imbalance in the contributions you have from female and male, because when you invite it usually come more females, and then you find more difficulties involved female.
Mm-hmm. Yeah. Mm-hmm.
Is this, I mean, it is a very tricky aspect, because we noticed the same in Italy, for example, not only due to the numbers that are greater for you, the women's, but also the attitude. And I think also the critical perception, it's different to how much different is this behavior when you introduce some innovative.
Yeah, so to start with, indeed, it's easier to reach out to women than to reach out to men, or to have them in your sessions. But when we agree on an assignment with an organization or with a company, we always point out how the balance or how the mix would be. So if it has to be a 50-50 male and female, we just look until we have 50-50% male and female. Now, for the study, for the sleeping device, this was not necessary in the first place, but it was important that we had this input from the male as well. So that is why we conducted a separate study with male participants on that one. Do they act differently in a session? Probably yes, but it's also person depending, of course. So even if you have different types of males, you have different types of females, and I think when they want to contribute to a session in a co-creation, then they are open to share their experiences, and we still gather valuable input both from male and female. And it's more about personality than in that case than really the gender difference.
Yes, I see. I also you provide in your experience how difficult it was to sustain all this interaction, and you mentioned that you are involved in projects at European level, especially projects. But do you think it is possible to imagine a kind of a way of funding LiCalab that is not only related to project, because if you focus on project, you have also to perform the activities related to the project, you have to answer to the research questions, and you cannot probably sustain how many companies you can, because some of the activity must be dedicated to your research activity. Do you think that that your business model can be changed a little bit with some kind of private or public funding, or it's better to leave you independent in order to provide a more general type of services?
I think it's quite important to have an independent approach. So we are part of a University of Applied Sciences, so which gives us indeed a position of being neutral. And I think when you work for different companies, that's important that you are neutral. The question of funding or not funding, I think it's difficult for a LiCalab to just sustain from the income from companies. So in a way, you will need maybe not funding, but a structural support from, for instance, a local government, or from an academic institution, or from a health cluster, where you have a basic structural income. That can be added up with project funding, of course, and I think project funding doesn't really have to turn around funding, but also around the fact that projects give you the opportunity to collaborate with many actors, and that's also important, because it gives you the opportunity to build something. And then, of course, you also have to keep in mind, when it's project funding and you write a project and you have this project, that you look beyond the project and how can that project be sustainable? So not necessarily your living lab, but the project in itself also. So I think you need these three parts of funding. So first, like a structural basis from an institution or an organization. Secondly, project funding. And third, income from private assignments.
That's clear, thanks. So I think we can stop. Also, I really would like to thank you for your presentation, for stay so active in answering my question. Also, if your voice is not so perfect, so sorry for pressing you. If
No problem. No.
If there are no other questions,
still, just to be sure about it, I understand that you have 8 stable employees for doing all this work. As you presented them, your team. Yes, that's right.
Yes, that's right. Yes, yes. It's like seven full-time equivalents. So we're 8 persons, but not all of them are full-time. So it's 7 FTE. Yeah, that's correct.
And that's something you included that into so-called, as you explained it, into basic funding. Yeah.
You mean the personal?
The personal, yeah. Your team.
We a part of the personal. So I think that 2 to 3 full-time equivalents from our team are structurally funded by the Thomas More University of Applied Sciences, and the rest we look for ourselves in project funding or in income from assignments. Yes.
Yeah, fine. I see. Thank you.
So thanks a lot, and I think we can close now this session, and the record will be put online for those who are not able to join this meeting today. So have a nice day. Thanks so much. I would like to exhort all the people who are interested to know more about LiCalab to look at this contact, to have a look on your website. You are so active also in communication, so you have a lot of information that you can share with all the persons that are interested in collaborate with you, but also to know more about your experience and maybe create a new living lab in a different reality.
Yes, always welcome to receive questions or to give some insights from people who would like to learn more.
Thank you so much.
Thank you very much.
Thank you. Bye-bye.
Inspiring.
Thank you. Bye-bye.
Thank you. Bye. Thank you.
Bye-bye.